So before I start the session, I want to mention a couple of things. I've been listening to all the speakers and the discussion for the last couple of hours, and from hearing from everyone convening on mental health from their various perspectives has been really heartening and inspiring. And I hope that's been the case for everyone here. I've heard a lot so far. I have to put it this plug. This is sort of my thing here. I've heard so many things about, drugs and opioids and how we kind of look at it from a perspective of law, the justice system, and how we address the use and the substance abuse. I myself, as an oncologist, radiation oncologist, I've been practicing for 20 years in a setting of VA hospital in a Seattle VA and then also Long Beach. As an oncologist, I've also taken care of a lot of mental health, issues among my patients, and I see opioids differently. Opioids in my toolbox is what relieves pain and suffering for my patients. So I just want to offer that perspective, even though that we can, there is a bad side, quote unquote, to opioid use, drug use. There's also a very good side, a humanitarian side, a compassionate side of drug use. So with that, I'd like to open this third session and introduce Director Donnie Anderson. Director Anderson is the director of the Oklahoma State Bureau of Narcotics and Dangerous Drug Control. He's a native Oklahoman, began his law enforcement career over 30 years of the Garvin County Sheriff's Office. During his time at the Sheriff's Office, Anderson served as both the undersheriff and sheriff. He then served as a task force commander for the District 21 Drug and Violent Crime Task Force, which includes Garvin, McLean, and Cleveland counties. Before his appointment to the OBN DDC, Director Anderson served as the Oklahoma Inspector General for the Oklahoma Department of Corrections. He graduated summa cum laude from the Central Christian College of Kansas with a bachelor's degree in criminal justice. Please welcome Director Anderson.
Thank you very much. It's absolutely an honor and a privilege to be here today. A couple of disclaimers I got to throw out there real quick and an apology. First off, I'm the public safety guy. I'm not a doctor. I'm not the lawyer. I am 100% a public safety guy. And I know whenever he talked about my education, yes, I got a higher education from a faith-based college in criminal justice. So obviously, I move my life, I move through life. And what I do is one, through my faith, and two, what I think that I should do legally through public safety. And I think public safety is a very important part of what this absolutely country was founded on and how we maintain integrity in this country. A little bit about me. Yes, I'm a native Oklahoman from rural Oklahoma, but I'm actually should be the statistic that everyone's been talking about that I heard earlier today. Grew up in South Central Oklahoma. My father, my whole life, he lived to be 73 years old, but my whole life growing up, my father was addicted to drugs and alcohol. When he died, my sister went to his house, and on the couch that he died, next to him was a gallon of vodka, half drank, and a bottle of Oxycontin. Whenever I was a kid growing up, I remember my dad smoking marijuana and crack cocaine, and just being a bad guy as far as an outlaw is concerned in Oklahoma, and in and out of prison, including federal prison, my whole adult life. But he was my dad, don't get me wrong, and I love him for that. But when I talk to you, I'm talking to you from a public safety aspect. I'm also talking to you, yes, I testify in federal and state court as an expert witness, but I'm talking to you as a person that's lived it my whole entire life. I mean, from the day I was born up until this very moment. That's all I've done. That's all I know. But I really am and should be, according to statistics, who everybody's been talking about. But I made a very conscious decision at a very young age. I would never live my life like that. And if I was ever fortunate to be blessed with family, I wouldn't raise a family like that. So that's how I lived my life, and that's how I've moved forward. But absolutely should be that person. And I've even, and believe me, I know my underlying biases. Everybody does really have them. but I also have an extremely bias to what goes on in Oklahoma. So whenever I hear, and once again, I'm a public safety guy. So when I hear stuff about there should be no enforcement, we got to decriminalize this, we shouldn't criminalize that. Listen, it takes all of us together, and it takes all the tools in the toolbox to be effective. One thing you're going to find out, even though I'm a public safety guy, I am the biggest proponent, and I will tell you 100% that treatment works. And without it, we fail, because we absolutely cannot and will not incarcerate our way out of the problem that we're in. And we are in a huge problem. We are in the middle of an opioid epidemic. We're also still in the methamphetamine epidemic. Methamphetamine and opioids is the two drugs of choice in the state of Oklahoma. We have more people die from fatal drug overdoses in the state of Oklahoma, and you are more likely to die in the state of Oklahoma from a fatal drug overdose than you are by the hands of a gun or a vehicle accident. It sits at number 4 right now, with heart disease being number 1. And I'm sure someone's already talked about that before I did. Precursors of methamphetamine and fentanyl come from China. And whenever I talk about China, people, please understand, I'm not talking about a race. I'm not talking about a nationality. When I talk about China, I'm talking about a communist country, because everyone in China isn't bad people, no matter where you're at. But it is a communistic country that has a very disdain for America. And if you don't think the things that they do isn't by design, that's absolutely, in my belief, it's very well designed. One of my good friends, who is the national director for DEA in that region, and he's from Oklahoma too, by the way, southeastern Oklahoma or southwestern Oklahoma. As soon as he got there, he's going to hit this full force with China. He went and had a meeting with the government in reference to fentanyl and the precursors of methamphetamine going to the cartel, which obviously comes here. And they said, that's not our problem. That's your problem. Yes, we can stop things from coming out of our country, but your country has the problem with addiction. They're right about that. But once again, they could slow down the precursors that come to the U.S. if they wanted to, but they don't want to. Absolutely don't want to. We do have more people dying from methamphetamine than we do any other drug. It's still our number 1 killer when it comes to fatal drug overdoses. But fentanyl is closely moving in. Actually, if it wasn't for Narcan, fentanyl would have already passed it, I promise you. Marijuana, I'll talk a little bit about marijuana. I'm not going to go crazy in depth in marijuana. Also, once again, I am the public safety guy. I do know some of the science behind each of the drugs. I do know what each of the drugs can do to someone. But I will tell you tomorrow, if you have the opportunity to listen to Dr. Beeman, he is one of, not just in Oklahoma, the expert in the nation. He is one of the leading nations in this nation about marijuana and some other drugs, and he is really phenomenal. So if you get the opportunity to listen to him, I would listen to him. Also, whenever I talk about drugs in Oklahoma and what we do, whenever I came to the Bureau a couple of years, I had a little bit of a difference of opinion on what we should be doing at this level. We are the drug enforcement for the state of Oklahoma. Whenever I came in, I am a numbers guy. I do basic policing with numbers, looking at numbers and evidence-based policing. And I seen that we arrested an astronomical amount of people. And whenever I looked at that, over 7,000 people in 1 year. And whenever I looked at that, I started looking at the charges, and I saw 90-some-odd% of those were for 1 gram purchases. And I even asked some of the senior staff, I said, what is going on here? Why are we buying grams of methamphetamine? We're competing for federal dollars, and we're competing for dollars at the Capitol. So they thought, their theory was that the more people you arrest, the more money you get. Well, they didn't get more money. If anything, it cost the state an abundant amount of money, because we absolutely did, for many years, put people into prison that should not have been in prison. Absolutely. I'll be the first one to stand up here and say it. Should not have been in prison. We should not be arresting and imprisoning addicts for being addicts. At this level now, what we do, and we actually, my first year at the Bureau, we arrested, it was 107% less people, but see 722% more product. We went from 300 pounds of methamphetamine seized to over 3,000 pounds of methamphetamine. You do that by investigating national, transnational organizations, and that's absolutely what we do now. Real quick on our overdose deaths, if you look at the fentanyl overdoses, they're, like I said, they are about to pass methamphetamine. If it wasn't for Narcan, they absolutely would pass. THC toxicity, what's interesting about this, you'll see how high our THC is getting marijuana, no pun intended, but it is really an astronomical amount of THC that is in this. And the troubling thing is the children younger than 5. Now, this isn't the drugs problem. This is an adult problem. This is, you know, if someone has this as medicine and you have someone that's 2, 3, and 4 years old that's getting into this, because there's no 2 or 3, 4-year-old that's lighting up a joint smoking it. They're getting into the product that the parent has. Some of this stuff looks like candy, and that absolutely is what it is. So when those numbers are pushed out there, I always try to clarify that a little bit, because sometimes in the past, law enforcement tries to throw stuff out there to scare you. Oh my God, they're getting kids hooked on marijuana or this or whatever it is. Like I said, the juveniles, when I say juveniles, I'm talking about the under 5. It's accidental overdoses is what it is. It's not on purpose. Seizures, as I was talking just a second ago, some of the seizures, if you can see, yes, there is plenty of drugs in the state of Oklahoma. Oklahoma has become what Dallas, Texas was probably 10, 15 years ago. Used to, it would come over the border, it would go to Dallas, then it would be disseminated across the U.S. Now it never touches U.S. soil or gets offloaded until it comes to the Oklahoma, a lot of times in the metro area, sometimes in very rural, desolate places across Oklahoma, then it's transported out across the U.S. The last 3 years, we have dismantled several major transnational organizations from all over the world, not just Mexico. You can also see the seizures of fentanyl. But I will tell you this, the deal on fentanyl, the raw fentanyl that we see now and the pills, that's just the last few years. It just wasn't prevalent 10 years ago. There just wasn't fentanyl like it is now. And of course, the marijuana, I'll get off onto that a little bit here in a little bit about what's going on in marijuana. Treatment admissions. Like I said, I'll be the first one to tell you treatment really does work. And during the pandemic, it went down. There was a lot of different opinions on why it went down. Some people thought it was because we decriminalized some things that we're not getting more people into our diversionary courts. But obviously, a lot of it had to do with just treatment places were being closed because of COVID. Because since then, we're actually surpassing our treatment than before COVID. Methamphetamine seizures. I put this in here just to give you an idea a little bit about what's going on here in Oklahoma. The picture over here to the left, that is ice. That's called methamphetamine ice. And this is actually how it was smuggled from Mexico to Oklahoma. And this right here, those are 2 kilos. So a kilo is 2.2 pounds. So each one of those bags is 2 kilos. And this was just off of one search warrant. This one over here to the right, and the reason I put that in here to also give you an idea, what you see in those blue jugs and in the diesel jugs, that is liquid methamphetamine. It is smuggled from Mexico into the state of Oklahoma in liquid form. A lot of times it's smuggled in tankers, fuel tanks, regular, a lot of milk trucks seem to don't have milk in it, but instead of milk has liquid methamphetamine. But it's several thousand gallons of liquid meth that comes into Oklahoma, and then in conversion labs, they convert it into the product you see right here. This actually came from a big ranch just northeast of here. And just through the video alone, whenever we served the search warrant, they was bringing in one of these big tankers once every week. That's several thousand gallons, which means several thousand pounds of methamphetamine they was producing every week here in Oklahoma, disseminated across the U.S. Fentanyl, this is predominantly how you see fentanyl smuggled into Oklahoma and into the U.S. And the reason why is because these blue pills you see are very well counterfeited to look like Oxycontin. Here in 30s. And that's what we're going through right here in Oklahoma, as well as the rest of the U.S. But people think they are taking an Oxycontin when they're not. They're taking 100% fentanyl with a little bit of binder. And, you know, a lot of people I've heard I speak all over Oklahoma, I even go to other states and speak. And I get this all the time. Why do we care? Well, if you're stupid enough to put that in your mouth, then you deserve to die. I absolutely disagree with that on so many levels. But one thing also, understand, it's counterfeited at every level. Almost every illicit drug that's on the market now has fentanyl in it, including methamphetamine, cocaine. Any pill that you purchase off the street typically has fentanyl in it. It's not coming from a pharmacy. It's coming from a clandestine laboratory from Mexico. And these counterfeits look just like the real deal. They're really good at it. I've seen some really crappy ones, but I've seen some really good ones. And they're very, very strong fentanyl. And also understand the cartel, when they do this, they're not doing this trying to kill off other people, because they don't want to kill their clientele. But it really is a guessing game, because everybody has a different tolerance, and you don't know what that tolerance is. So it's an absolutely guessing game. But whenever we say that, and the DA had the big program about one pill to kill, it really is true. But also understand, whenever one of these kids gets a prescription pill, they really think they're taking a prescription pill. And there's no way around that. I mean, they're going to do it, because when you're young and dumb, you also are invincible. And when you see these, you don't know the difference. You don't see that and think that comes from a clandestine laboratory in Sinaloa, Mexico. You think that come from some pharmaceutical grade pharmacy is what you think. Absolutely not. I promise you, if you're purchasing something on the street, it typically will have fentanyl in it. We've recently here in Oklahoma also seen xylazine. I don't know if y'all know what xylazine is. Xylazine is an animal tranquilizer. And it's real big on the East Coast. People in Philadelphia, when they talk about zombies, and I don't know if you've ever seen it, but that's exactly what it does to you. And wherever they inject the drug at, it causes that part of their body to rot. And usually they have that part of their body amputated. And it is in Oklahoma now. Marijuana grows. And like I said, you know, so I've been labeled across the nation because Oklahoma is the #1 producer of marijuana. So they call me the anti-marijuana guy. I'm not anti-marijuana, but also I'm not the doctor. I'm not a guy behind the science that says, and I have seen some science on this stuff. I don't think it cures cancer. So I'll tell you that right now. But I do think there probably is some benefits that some people could use from it. But do I think it really helps you with gas? No. So got to call BS on that one, folks. And it definitely isn't curing cancer. No data, no science behind it. There is not a lot of science behind it to begin with, but there is some science, and some of that science just doesn't add up. What I am against, because we have the most liberal marijuana laws, folks, in the union. And if you can't do it right in Oklahoma, it's probably because you was a bad guy to begin with. Think about that for a little bit, because it's really easy to get a license and operate legally in the state of Oklahoma, but we have so many people that don't seem to be able to do that. Also, whenever we come to these grows, it's like going to a third world country. I don't know if anyone's ever been to a third world country. If you haven't, go with me sometime. I'll take you to it right here in Oklahoma. You see people living in the most deplorable conditions that you wouldn't allow your animals to live in. And these people that are there aren't there because they want to be there. These are people that are trafficked into the United States. Also, one of the most deplorable things that goes with this is the sex trafficking that goes with this industry. It is despicable. In Oklahoma, right now, we have 6,282 grows. I don't know if anyone's been paying attention to what's going on, and it's probably also is why I'm being labeled the anti-marijuana guy. We go to these grows doing search warrants all the time. I've had my guys in one that caught on fire. They had to cut their way out of it or they would have died. I had an agent that was shocked. I went to one just north of here, about 20 miles, saw a kid with his face burned off. And I said, how is this happening? How How are they able to get their CO, certificate of occupancy, and do this? Are they adding on to these places? Are they adding stuff in here after they get it? Well, come to find out, they weren't getting it. No one was making them get it. So I sent a letter out last December and January, to every one of these grows. And I said, this year, when you register, I don't care what you do with OMA, but when you register with OBN, because your license is through OMA, you have to register through OBN because it is still a controlled dangerous substance. I won't give you that registration unless you have a CO, because I'm not putting my employees in danger no longer. I'm not going to put the people that don't have it, even want to be there, in danger no more. So as of this morning, whenever I checked, that's 6,000, and this closes, the registration closes in Oklahoma for OBN at the end of this month, next week. So last year at this time, we already had 6,000 renewals. As of this morning, we had a little over 1,002 renewals. And only 300 of those renewals said they was going to grow indoors. Because if you grow outdoors, you don't have to have one. Y'all know what it's going to do this weekend? It's going to freeze. Anyone got any plants outdoors this weekend? They're going to freeze. So if you think the other 800 is going to legitimately grow marijuana outside in Oklahoma, December and January, once again, folks, I told you my disclaimer at the very front. I'm from South Central Oklahoma. Knuckle dragging cop, not the smartest guy in the world, but I can see through that bull crap. If you look at the dispensaries in Oklahoma, 2,373 dispensaries in Oklahoma. Well, it's very interesting, and according with the grows too. You notice how we have all of these grows on our borders where there's not a lot of population, right? Why do you think we have dispensaries on our borders close to Texas, where it is illegal, by the way? Do you think we have that many people in, well, over there by Kingston? Anyone know where Kingston is? Pretty rural, pretty small. My son played football at Davis. They used to play Kingston 2A, Class 2A, very small school. 4 dispensaries in Kingston. Are you kidding me? 2,000 people. Listen, we have 918 pharmacies in the whole state of Oklahoma. Dispenses millions of prescriptions. 8% of our population even got a medical marijuana card. So once again, whenever correct me, I'm not the smartest guy. My disclaimer right up front. You don't have to be real good at math to see this ain't right. So that's what I'm trying to address, because also understand, whenever we allow this to continue, what you're funding, what this state is funding, you're funding communistic, terroristic countries who are in this state growing marijuana, transport it to other states, transport it to other countries. That's what they're doing. Once again, medical marijuana patients. Now, y'all remember the song that I see? A lot of folks in here got hair like me. We don't smoke marijuana in Muskogee. That ain't true. That absolutely isn't true. Matter of fact, it's a great song, but it's not true. But also, you got to look at the numbers. We're a rural state. We're 4 million people. And when you say 8% of our population has a medical marijuana card versus what California is, understand that's 40 million people. So those numbers are a little different. 3,500 medical marijuana patient cards in the state of Oklahoma. But once again, if y'all know what Metrics is ran by OMA, the Oklahoma Medical Marijuana Authority. The little study they just did put out, they said over 22 million pounds of marijuana was diverted to the black market. My agency seized a little over 1 million pounds itself. Now, if they know 22 million pounds was diverted in the state of Oklahoma, 22 million pounds, it's a lot of weed. But if 22 million pounds was diverted because this little tag on it, I'm telling you, I was in over 800 grows, they didn't have one tag. So honestly, you're probably looking more like 40, 50 million pounds of marijuana that was diverted. Everybody says, hey, we're making all this money off marijuana. You better be careful. No, we're not. This isn't taxed marijuana. 22 million pounds was untaxed, by the way. It's not taxed unless it goes to a legitimate pharmacy. And even if it isn't about taxes, also stop and think. The product that's going to people that they're ingesting into their bodies has mold. It has chemicals that come from countries that we don't even allow in this country. Carcinogenic chemicals, chemicals that causes cancer. That's what's on this product. So if you're buying this product, that's what you're putting in your body. That's also something we gotta address. And it's also affects our environment. Legal, and then, I went over quite a bit of this, talking about what it is. Folks, it really is easy to do it right. But I also will tell you, there is good people in this industry. Unfortunately, I don't get to talk to those people because they're doing it right. So, but that's a very small number that is doing it right. Pure economics, pure numbers tells you, look at our neighboring state, Arkansas. Does anyone know how many grows Arkansas has? And it's a very comparable state to us. They have 8. 8 grows. 8 grows in the whole state of Arkansas, and it does more than, they destroy quite a bit of that out of that 8 grows, by the way, but it produces more than enough marijuana for their market. We really need 6,000? No, we don't. I also, just real quick, I want to touch on some of the crimes that come with these things. And the sex trafficking really is one of the most deplorable things I've ever seen in my life. So I personally have spoken through an interpreter to some very young girls who were underage that was smuggled into this country. They knew that it was in the U.S. because of the language barrier, recognized the English, but they didn't know where in the U.S. they were. And they were smuggled in this country, and they was put into the sex industry, and that's what they did. And I'm talking about very, very young girls. And it breaks my heart whenever I see this stuff or deal with this stuff. This is a picture of one of these casinos. And I throw this picture in here just to back up some of what I said. One of these young girls, whenever we did the search warrant, and that's not the Norman deal, but this search warrant over here was in the metro. We served that search warrant at 8:30 in the morning. One of these girls that I talked to, there were 3 of them, and they were tied up and hidden in the closet. 2 of the 3 were tied up. One wasn't, because one of them was having to work. Whenever I talked to her, and this was early in the morning, I asked her, because they was using her in the sex industry, I asked her how many clients that she had to see that morning, because we actually did surveillance on it that morning before we ever go hit it. We seen quite a few people coming and going, but within that hour and a half of what you wouldn't think would happen was over 40 men, according to her, that she had already serviced in the sex industry. That's what I'm talking about. This is a juvenile. Once again, it's one of the most deplorable things that I've ever dealt with. Also, I know they had in the news yesterday, we had another one. We actually got the other guy in custody today. They fled because they knew that we were on to them, because we actually recovered a couple of very young girls that they were prostituting against their will, by the way. And we got them, the other one, in custody today. But I also tell you, there's even people in the industry from these foreign countries. They'll tell you, we can't talk to you. If we do, they'll kill our family back home. So we have no victim. We still provide services to them, and we get them out, try to get them out of that environment. But they're put in some really, really difficult situations. Federal overdoses by year. We did have a little bit of a dip in 21, but in 22, you see how much higher we went, folks. I looked last week. We're going to surpass that. So we're not close to where we need to be. I think every time we see a dip, we think that we're coming out of it. We're on the other side of it. I think we're a long ways from it. I don't know if y'all's ever heard of carfentanil or some other fentanyls, which is even more potent than fentanyl. There are also now starting to rear their ugly head here in Oklahoma. So I think we're going to see a whole nother wave. This is the fentanyl is the second wave. I think we'll see a third and maybe even a 4th wave with this opioid problem. By comparison, once again, I told you that methamphetamine is our drug of choice. You can see that we have more people overdosing on methamphetamine. I can tell you, as of last Friday, we was only a few separations for this year between fentanyl and methamphetamine. Fentanyl, I do think this year will surpass methamphetamine. Also understand Yeah, we do still have a high number of methamphetamine, but almost all the methamphetamine is adulterated with fentanyl too. So what the numbers tell us, it's hard to tell us exactly what it is, because if you overdose, the screen tells us you had methamphetamine, whatever all you had in there, so they all count. So we're going to have even more people overdose on methamphetamine that I think we probably wouldn't have had because of fentanyl. But fentanyl is the big time and on the rise. By the year, go back to our conclusion. Important points. There's no doubt we're in an epidemic, and listen, I'll be the first one to tell you we're a ways away from being done with it because of the drugs that are also being introduced into Oklahoma, the other carfentanyls that are even more potent than fentanyl, and the xylazine that's starting to come through. My agency does a lot of wire intercepts, and we actually have people requesting stronger fentanyl. So whenever we're talking, so in Oklahoma, the way it goes is when you call and you're talking to someone on the end of the phone, ordering up a large amount of drug, whether it's methamphetamine or cocaine or fentanyl, 9 times out of 10, you're talking to an inmate in a prison in the state of Oklahoma. You tell that inmate, which you don't know it's an inmate, by the way, they do, believe it or not, have cellular devices, contraband devices in the state of Oklahoma in our prisons, as well as drugs and everything else you can get in there. So they call them up because the cartel's embedded with the guys that are in prison, because those guys really don't have much to lose. And I'm talking about even guys that are in prison for life and on death row. And you order up keys. And that's pretty much what we buy. We buy kilos of whatever product we're buying. And we know, because we're on a wire intercept, we're talking to a guy in prison because the phone's pinging at the McAllister State Prison in McAllister. So we talk to him, then he hangs up. He calls the runner, which is a cell of a cartel guy, and he'll tell you to meet at 7-Eleven on 23rd Street. What are you driving? You tell him what you're driving. You pull up, you get your drugs, and they drive off. It's called taxiing. And that is the way it's going in Oklahoma right now, whether it's methamphetamine, fentanyl, whatever, other than marijuana, whatever drug you're wanting. 9 times out of 10, you're talking to some guy in prison, one of our many prisons in the state of Oklahoma. That is something that we're also trying to get a hold of with Department of Corrections. We're actually cutting those devices off with some technology. So that's actually starting to put a hamper on it as well. But it is a cat and mouse game. They will find another way, meaning the cartel, for someone to move their drugs. And believe me, there's plenty of organized crime, organized gangs in the state of Oklahoma who's willing to step in and take over the prisons operations, because it is a lot of money. And also your guys in prison are connected to the guys out here on the street, because it all is pretty much gang based, from white gangs to black gangs to Hispanic gangs to other culture gangs. I mean, if it's in Oklahoma and it's in prison, you're in a gang. And I heard the judge talk earlier about how hard it is when you go to prison, you become a better criminal. I'm going to be honest with you. It is hard for a guy to go to prison in the state of Oklahoma and just go do his time. When you go to a prison in Oklahoma, if you don't belong to a gang, you're going to belong to a gang, or they're going to kill you, typically. I'm going to have to wrap it up. Just some of the numbers real quick that we've done. We will continue, and our COs will take effect on these outlandish grows across the state of Oklahoma, and you will see that starting to move as well. Summary real quick. I really do believe it takes all of us working together to make a difference in this. I do believe treatment works. I know it works, but I also think people's got to quit pitting against dollars. We have to have diversionary courts, we have to have treatment, and you have to have enforcement. I firmly believe that if we don't have enforcement, you have total anarchy. I do believe that, but also understand, I told you from the very beginning, I'm a public safety guy. Hey, I appreciate you all. I know here in a little bit, we'll sit down. If you have any questions, please ask me. That is my contact information. If I can ever do anything for you, if you ever have any questions, please feel free to reach out to me.